And good evening, ladies and gentlemen, and Professor. This is our group research presentation on psychological maltreatment of children.
I'm Natalia Bonilla.
I'm Jamie Chavez.
I'm Daniela de Leon.
I'm Samuel Gonzalez.
I'm Leslie Granados.
Joseph Kunkel.
Madonna Sagredo.
I'm Lucy Sanchez.
It's crucial for society to acknowledge and take action if there's any suspect of child psychological maltreatment, also known as CPM. The patterns of negative behaviors from the parent or the caregiver can affect the children cognitively, emotionally, and socially. Suppose you suspect a child experiencing psychological maltreatment. In that case, it's essential to report your concerns to authorities such as Child Protective Services for the child that can receive help and the protection that they need.
Child psychological maltreatment, also known as CPM, is a form of child maltreatment that involves emotional maltreatment or neglect of a child. It can have serious and long-lasting effects on a child's mental health, emotional well-being, and overall development.
Short-term effects when the child is experiencing CPM, one of them would be behavioral problems. Behavioral problems are a short-term effect when having CPM. 40% of children have behavioral issues that can have outcomes such as an aggressive behavior, post-traumatic stress systems, or suicidal thoughts. Another short-term effect is interpersonal maladjustment. This is a short-term effect caused by CPM. 52% of the outcomes for a child with interpersonal maladjustment could be an insecure attachment to the caregiver, low social competence skills, trouble building friendships, and having difficulty with maintaining relationships with peers. Lastly, learning problems can also be a short-term effect. 29.2% of children experience learning problems. It could also cause them to have poor decision-making, academic issues, or difficulty with solving problems. Now, for the long-term effects, low self-esteem is one of the long-term effects with CPM. 47.62% of children experience this effect and struggle with their confidence, negative self-image, and tend to seek approval. The next long-term effect is depression. 52.38% of children experience depression. Some effects you can look out for is social isolation, post-traumatic stress, mood swings, or emotional distress. Lastly, neglect is a very big long-term effect that is experienced during CPM. 90% of children experience neglect. This could be with their own parents when they are not invalidating their feelings. The failure to meet a child's basic physical, emotional, educational, or medical needs as well counts as neglect. When it comes to psychological maltreatment, emotional neglect is most common.
Children reported feeling scared or bad about 5 to 10% of the time when adults in their lives called them names. A much greater risk of CPM is associated with older children, according to both the NIS4 and the Third National Survey on Children's Exposure to Violence, also known as NAT-SCEV III. According to the Third National Survey on Children's Exposure to Violence, the Third National Survey on Children, approximately 16% of 14 to 17-year-olds experience emotional abuse, compared to approximately 7% of children between the ages of 6 and 9 and 10 to 13 years. The difficulty of reporting associated with young age makes it difficult to interpret these data. Among females and males, there were no significant differences in the incidence of emotional abuse or neglect based on data from the NIS4. However, based on self-report surveys, girls are generally more susceptible to CPM than boys, while boys are equally likely to be brought to the attention of mandated professionals. As for race, finding from several of the national incident studies suggested that race and ethnicity are associated with CPM. The NIS4 found that for emotional abuse, Hispanic children were at least risk, with both white and Black children showing greater incidence than Hispanic children. This study also found that Black children were at a greater risk of emotional neglect than white children. As measured by the CTS-PC, Black children reported higher levels of maternal psychological maltreatment than white children in one study of large sample of young adults aged 18 to 25 years. A study that assessed the global prevalence of psychological aggression within residents of several low and middle income countries using the CTS found that approximately 65% of parents yelled, screamed, or called their children dumb, lazy, or another name between the ages of 2 and 4.
For our group's theoretical connection portion of our project, we decided to go with Maslow's hierarchy of needs theory. Essentially, this theory includes 5 categorized themes. The first one being physiological needs. In humans, most of our motivation depends and comes from this physiological need. The second one being the need for safety. The safety need is especially evident in children because they usually tend to thrive in a more predictable world. The third one is the need for love, and in a way it's also includes the need for belongingness because it refers to one being able to not only give out love but receive it as well. The fourth one is the need for esteem. The esteem need is to want a stable, high, or respectable evaluation of yourself. So basically just to have your own high self-esteem. And the fifth one is the need for self-actualization. This refers to being sure of yourself and doing whatever it is that you can to be happy and just be self-fulfilled. So our theory's main points resonate with our thesis because if at any point in a child's life they lack any of these needs, it could result in a child's short and long-term cognitive behavior to be affected negatively. Also, if a parent ever has any sort of negative behavior towards their child, it can also impact them emotionally. So it can affect the child's emotional and social stability. In order to break the cycle, it has to start within oneself. Having these ideas and toxic mindset of that it's okay to treat a child poorly, to scream at them, to hit them, to get rid of these ideas. And this is supported by Maslow's theory, where it talks about self-actualization because it talks about personal growth. And in one's personal growth, this is where you can break this cycle within yourself first.
Our organization is called Violence Intervention Program. VIP is one of the largest hubs with 6 health centers across LA County. They created a medical tracking system and program that provides 24/7 care. The tracking system allows VIP and other providers in LA to track any child who may have experienced abuse. They provide on-site mental health and case management services for children who experience abuse and neglect. The purpose of VIP is to provide the best mental health services available and strengthen the child welfare system through its innovative tracking systems and partnerships between the Department of Health Services and Children Family Services. The lack of resources in the child welfare system during the 1980s inspired Dr. Astrid Heppenstall-Heger to create a program that provided victims of family abuse better services and resources.
The Violence Intervention Program stands by their mission and vision. Their mission is to provide the best mental health care and services to victims of family violence and abuse. Their vision is to improve the overall child welfare systems and ensure that children don't get lost in the system, providing them with the help they need.
VIP offers multiple services for victims of family violence and child abuse. The medical and mental health evaluations allow VIP to create personalized treatment plans based on the adult or child's needs. Case management between VIP and other programs in LA ensures that children suspected of experiencing abuse or neglect get the help they need. Traditional and group therapy ensures that VIP addresses emotional trauma and focuses on their mental health. VIP acknowledges that emotional trauma has long-term negative effects that can inhibit a child's quality of life. Having both traditional and group therapy allows there to be flexibility in treatment and caters to many children's personal needs. VIP offers many services to parents as well, and giving a parent proper tools and support needed to raise their child. The VIP lessens the probability of abuse or neglect. Their Birth to Five plan focuses on creating a bond between the parent and their child and educating them about harmful behaviors so they are able to avoid them and raise their child in a positive manner. Accessibility to mental health services is important to the VIP team, which is why they have school-based programs that provide mental health services in several schools. The program also focuses on educating schools about mental health issues and how they can support their students. The VIP outreach programs provide personal care to children and their families. It allows their specialists to provide care at a personal level, which helps ensures that they are given the attention and help they need. The outreach program covers mental health services, medication support, rehabilitation services, and case management. For the target population and demographics, VIP serves children and teens who are in the foster care system who have experienced trauma or neglect and are in need of treatment to work through the trauma. Besides children, VIP is dedicated to helping families gain a good mental health, gain positive coping skills, and forming positive behavior in the home in order to raise their children in a safe environment. VIP prides themselves in being inclusive in the types of services offered to a range of demographics. This includes children up to 18, adults, young parents, single parents, and families. VIP has 6 health clinics across LA County. One of their clinics is near a school located about 3 miles off campus. With their online tracking systems, partners in the county can ensure any child suspected of child abuse gets access to resources that may help. It allows services to reach the broader community of LA. So for prevention, intervention, and education, prevention-wise, VIP offers the Birth to Five services, which prevents abuse and neglect within the home by providing mothers a support system. These services focus on creating a healthy bond between the child and parent to create a safe environment at home. VIP recognizes that mothers may experience anxiety or depression after giving birth, and this inhibits their ability to parent. Mothers need adequate support so they can raise their child in a safe and loving home. VIP has many intervention programs such as therapy services and the outreach program. Both services seek to provide health and mental health services to individuals in needs. These programs intervene by giving patients resources they need to work through trauma and mental health issues. VIP has a few therapy options such as group therapy or individual therapy sessions in order to be inclusive to many groups of people. The outreach program creates more inclusivity as it provides the same services in their clinic to people's homes. It makes it convenient and effective to many. Education-wise, and VIP understands that education is important when concerning mental health and psychological abuse within children. They provide educational services that focus on creating an impact in both the home and community. Parenting services provided at VIP educate people on healthy coping mechanisms when raising a child. VIP has connections with a few schools in LA where they educate schools about mental health and how to support students. They also have professionals in the field on campus in these schools where children can seek help.
The program is dedicated to breaking the cycle of abuse by providing comprehensive mental health services for survivors in ways individuals each feel comfortable in. They offer individual and group therapy or home-based sessions for survivors in need. Birth to Five programs is a program that creates positive family patterns that can address behaviors in healthy ways for long-term family well-being and help caregivers identify their symptoms of trauma or mental health issues. School-based programs is programs that offers school-based therapy with services in schools while educating school administration on mental health awareness to support students. Recover, Resilience, and Reintegration provides community outreach services, mental health services, medication support, case management, and more, created by specialists that works closely with children or youth and family to help support and meet treatment goals. FASD, Family Support Services, are offered to strengthen coping skills and strategies. It is a 6-week parenting class that educates caregivers on the link between brain abnormalities and the development and behavioral problems seen in their children with FASD. Case management helps advocates for the children's need and aids caretakers in prioritizing their time and resources for the family's best interests, such as food assistance and housing. VIP offers support for survivors and the parents or slash caregivers who take care of the survivor. VIP offers programs that help families learn how to approach conflicts and behavior respectfully and identify traumas. Other programs can help parents slash caregivers learn about coping skills. And a program, as an example, would be FASD, Family Support Services. VIP promotes resilience by emphasizing how children are the most vulnerable group in society, so they specifically dedicate more time and effort to developing comprehensive strategies to help children in distress. The website also provides several inspirational stories that promote resilience. These stories express different situations to which a survivor may relate. The stories form as a way of hope that they can get better with the program's help. The organization prepares survivors for society by evaluating children to identify the root of their suffering and then customizing support to help each child differently in the way that they need to be most successful. The support they provide to prepare for society is teaching skills that help them learn how to cope with emotions in day-to-day life. They also have programs that take place in school, which allows them to gain confidence in public spaces with people their age. Kiana, a female 17-year-old, was 5 when she started to get molested by her brother. The brother gets sent to juvenile prison after 4 years of abuse when her mother discovers what was happening. Kiana was blamed for what happened, and her mother started to not feed her and other basic necessities. She started to face physical and psychological abuse. When Kiana came to VIP, she needed help recovering from deep trauma of her childhood and the support to stay in a situation where she could get help. Along with counseling, Kiana also went shopping for new clothes with her clinician, made possible by the HEART program, which raises funds to directly support victims of abuse by providing the essential, non-essential needs. Angel is another victim, male 12-year-old. He ran away from his foster home and stopped showing up to school because he believed no one cared about him. He falsely accused his grandfather of hitting him, which led to the end of the relationship. Angel was depressed and would cut himself. A lot changed when he went through VIP, and he is now going to school regularly, and he is less impulsive and has agreed to ongoing counseling.
The social impact is a hypothesis to align with organization to breaking the cycle of abuse. VIP, as what we abbreviated for the, it's to breaking the cycle of abuse through an array of evidence-based practices on with, of course, individual counseling. The American SPCC stated that there's 3 paths that victims might get after being separated from the current abuser. One of them is getting into an abusive relationship. The second one is becoming the abuser, or third, it would be completely breaking the cycle of abuse. There are 4 areas to use breaking the cycle. One of them is sharing the truth and don't control. An example for that would be talking to a therapist or a trusting friend that listens and that would not judge. The second one would be be supportive and don't save them, which would be provide resources to the victim. Listen and talk without telling them how they should feel and validate their feelings. And the fourth one would be patient. Be firm, be loving, and be patient. Encourage the victim to be strong. Traditional therapy such as medication, hypnotherapy, and spirituality. Positive long-term outcomes for survivors would be mental health assessments, positive or protective factors that may have mitigated the factors of maltreatment, and whether the victim or survivors receive therapeutic services to assist in recovery. The client success rate for BIP in 2023 was a 94% success rate, meaning 94% of our participants haven't engaged in new crimes. And for American SPCC, the success rate stated was 78%. In connection with the research of our hypothesis with organization and theory for advocacy, the financial cost of child abuse and neglect in the United States is estimated at $585 billion. Researchers indicate in a person engaged means that they have been connected with resources that they need. How can society benefit from this organization? With the VIP intervention program, it's a community-based assessment for treatment in which they provide support for those who need it. It's also beneficial to our community because it is services that are provided 24/7, and the extensive amount of resources, it's numerously. It's also beneficial to our community because it is a mentorship.
That's the end of our presentation. And Joseph Kinkle will now present our digital poster board highlighting the Violence Intervention Program.
Good evening, ladies and gentlemen. Yes, I'm going to be presenting you the our visual board. As everyone have most heard, we have heard the issues on child psychological maltreatment of children, to where we gave a summary picture of what is the definition of maltreatment, to where it talks about the child experiencing the types of psychological, emotional, and feeling a form of abuse and neglect to themselves by the abuser, that affects them in their day-to-day life, and it's hard for them to grasp to it. And so to the VIP program, we chose that program to be an outlet resource to encourage those to use it, but also to be educated. We had our theoretical connection. We use Maslow's hierarchy of need, to where we talks about the psychological need of the child, the safety and the well-being of a child. Love. Child needs to be loved daily, from their parent to a guardian to a professional, or at a place that they're felt welcomed in, and being belonged to. The esteem of self-actualization, positive rapport, develop a rapport towards others, but also to know that they are special. The two types of needs is there's the deficit of the child and the growth from the child's development from early childhood to adulthood. And that is through Haley 2016. You have heard about the statistics that was being mentioned of our presentation, that 5 to 10% of children reporting feeling scared or bad. This is a concern for all children of all adults, both in the educational spectrum, social services professionals, and many other. When adults that had an impact in their lives, they're afraid to be called names or saying mean things to them, and the child may feel that way, or they say didn't want them, and it affects the child's needs. That Miller Parent et al. Explains that these numbers are not just small numbers. They're big numbers for a child that we need to be aware of what they're going through day to day. The mission is we want to provide positive and good mental health care to children and to adults who may have been affected by victim of family violence and such of many types of abuse. Our vision to prove that overall child welfare system can ensure to the child that they will not get lost, that they are guided to be successful, and that they are being cared. And that is providing them with the needs of help. That's where the professional assists the family, the child, to find that sense of support. Our main purpose through the purpose of the violence intervention program has to involve not just but one program, but plenty of programs, case management, mental health, and multiple variety. This simplifies also a path to recovery from an abuse issue, to recover from a victim that had been abused, to find healing from their own. That is across to the Los Angeles County. We have to assist the child who's been impacted by abuse, to the adult abuse, that's child abuse, adult abuse, elder abuse, but also it impacts on the LGBTQ community. In summary to all this, we want to encourage you to take this flyer.
Thank you. That's the end of our presentation.
Good job, Joseph.
All right.